Ken Cutbush. I'm an orthopaedic surgeon. I work in Brisbane as a shoulder surgeon. I'd like to talk to you about the rotator cuff. The rotator cuff is a highly specialized part of our shoulder's anatomy, and it allows us to do very special things with our shoulder. It's what lets us put our arm in space through this huge range of motion that we have with our shoulders and hold our hand in any particular spot and have force and be able to use that hand in that position. We share this structure of the rotator cuff with the great apes, the gorillas, chimpanzees, bonobos and orangutans. Really, no other animal has the rotator cuff the way we have, except for perhaps the Australian tree kangaroo, a marsupial. And so there you have two evolutionary pathways that have solved a problem both the same way by developing this rotator cuff structure. I'd like to talk to you about the rotator cuff, why it's special to me, why we see problems with it, and just a brief overview of what those problems are that we see in people's shoulders. If we take this app of anatomy, I'm going to go to the right shoulder, and then we're going to remove the deltoid muscle. The deltoid muscle is the prime mover of the shoulder. It has an anterior, a lateral, and a posterior component to it. Under it, we start to find the rotator cuff. So the rotator cuff has four components to it. It has a tendon at the front, subscapularis, one at the top, supraspinatus, around the back, infraspinatus and teres minor. And these four tendons form, to my mind, a socket that holds the head of the arm bone, the top of the arm bone, the humeral head or the ball of the arm in the socket. The shoulder is different to the hip joint. The hip joint has got a deep socket with a little ball that goes inside it, and it's intrinsically stable. The shoulder, however, is different. It's got a relatively large ball with a very tiny socket, and there's no intrinsic stability due to the bony anatomy of the shoulder joint. The stability largely comes from the rotator cuff. In lower order animals, the rotator cuff tendons are round tendons like this biceps tendon. That is the long head of biceps tendon, something that frequently causes problems in the shoulders. Well, in lower order animals, the tendons of the rotator cuff are actually round tendons. In us, humans, the rotator cuff tendons have become very broad and very thick, and they've coalesced together, and they actually, some of their fibers intermingle. And it's that gives us the great control that we have with our shoulders. It's what allows us to get our hands right up to here. Lower order monkeys can't actually do that. What they in fact do is lift their arm up like this, and then to get the final bit of elevation, they actually extend or arch their spine to get their arm all the way up. So it's these four rotator cuff muscles and their tendons that are so important. Now the subscapularis is not the most commonly affected, but it is one of the most important muscles and tendons in the rotator cuff. It actually accounts for half of the muscle volume of the entire rotator cuff. So the muscle volume of the subscapularis is equal to the muscle volume of the other three tendons put together. The one that is most commonly injured or most commonly involved with problems with humans is the supraspinatus muscle, the one that goes across the top of the shoulder. One of the commonest things we see with that is called impingement and bursitis. There is a bursa in between the tendon and the undersurface of the acromion. This is the acromion here. The acromion is part of the shoulder blade, part of the scapula, and it's the point of the shoulder. It arches across the top over the shoulder joint itself, and it gives origin to the deltoid muscle. It has a very important role. Well, the bursa is simply a slipping plane. There are many bursas in the body. Every joint has several at least, and what it is two smooth surfaces that allow movement to occur. Otherwise, movement wouldn't be able to occur because those tissues would be stuck. And that happens in some people, particularly after things like operations and so on. They can get scar tissue in there and get stuck. Well, the bursa is two smooth surfaces with a thin film of fluid between them, and normally you can't see it on MRI scans and so on. But when it becomes in trouble, it tends to fill up with fluid and quite often inflammatory material and becomes thickened and filled up with this inflamed material. And that's where it sits in there. And that can be quite painful. The other thing that we see is when you lift your arm up, obviously your arm has to swing up. Well, this area of tendon here has to swing underneath this ledge of bone, the acromion. And in people whose tendons are sore and they've got bursitis, it tends to rub as it does, and they get a catch when they lift their arm up. Typically, those people get a catch at 90 degrees when they lift their arm up to the side. And if they're not too bad, they actually tend to get a little bit better as they go a bit further up. The catch is more at 90 degrees. The other thing that happens with the supraspinatus tendon is, of course, rotator cuff tears. Rotator cuff tears are common. It's thought that by the time we're 70, about 50% of us probably have a full thickness rotator cuff tear. And the commonest place in the rotator cuff for a tear to form is actually the supraspinatus tendon, and usually at the front of the supraspinatus tendon, that area there. Now, the infraspinatus tendon, which is the next tendon around the back of the shoulder, that tendon there, this one is very important too. And what it does is turn our arm outwards, externally rotates the arm. So it pulls your arm out. And people who have a complete tear of that infraspinatus tendon have a lot of trouble pulling their arm out from the body. And in fact, if you examine someone with a big tear of the infraspinatus tendon, you can put their arm out like that and will tend to collapse because they can't actually hold it out there. And it's very frustrating for people that do have that problem. The teres minor tendon is the last one. It's at the back, right at the bottom. And the teres minor muscle also contributes to external rotation, but its contribution is most important when your arm, your humerus, is abducted away from the side, so at 90 degrees to the body, parallel to the floor, and it turns the shoulder outwards like that, externally rotates it in that position. So similar to infraspinatus, which does it more down to the side, but up here. So it also is an important tendon, but it's nowhere near as commonly injured or involved with pathological processes as the other rotator cuff tendons. So in summary, the rotator cuff is a very important part of the shoulder. It's a highly specialized part of us as humans. It's unique to humans and our cousins, the great apes. It's what allows us to place our arm with strength in this huge range of motion that we have with our shoulders, which we don't see with our hip joints. It is also a common cause of problems for people. You can have tears in it. You can get tendonitis. It causes pain, often associated with overwork or overuse. And of course, we see impingement and bursitis when we do have problems with it. I hope that gives you a little bit more understanding of what the rotator cuff is and what it does. Thank you.